Hi, everybody. Welcome to 2026. I told you I'd keep you up to date on medical news, and I'm sorry I haven't been doing these as often as I need to because there's just been so much. And so I do want to jump in here to talk about the vaccination changes that were made this week by the CDC. Lots of controversy and discussion around it, of course, because vaccinations are very near and dear to the pediatric community for very good reason. When you look at the success that we have had in reducing childhood mortality in the last 100 years, and even in the last 200 years, there's really hard to underestimate the value that modern medicine has had for the health and well-being of our population. And we are extremely lucky mothers to raise children in an era where most of our children make it to adulthood, whereas it was not that long ago where women could expect half of their children on average to die before age 5. We've made great strides, and that's attributed to a lot of reasons, but advocated a lot by the pediatric community. There's been a lot of really kind of negative language around the pediatric community, including things that were said by RFK and some of his allies, which upset the pediatric community quite a bit, particularly given that we are the lowest paid physicians and mostly do it because we love it. So implying that there's some sort of money incentive in pediatric medicine for vaccination is pretty offensive to most of us. The comments that we get paid to vaccinate is actually kind of the opposite of true. Many years ago, pediatricians were concerned that they would be accused of that. And so they made it a policy that vaccines are administered with like no profit to the physician, which I don't know what other kind of thing would be done that way. If you buy a shirt for $5 and you sell a shirt for $5, that's a really poor business model, but that's what pediatricians have been doing for many, many years, which has been an increasingly big burden. There are some states and some insurance programs, none that we participate here in Ohio, in the groups that we are in, that incentivize physicians for hitting certain marks, but they're really more like punishments if you don't hit certain marks because we already are the lowest paid doctors, so no one's making money off of vaccinating children. It's a pretty offensive thing to say. There is a lot of attachment to vaccinations as a preventative measure, and that gets everyone kind of riled up. But at the heart of this discussion, and really the changes to the CDC recommendation, has a lot more to do with human rights and laws and the way that we enforce mandates around vaccinations than it does really have to do with whether you as a parent should choose to vaccinate your child for any one or different diseases. In America, we have always been a very libertarianly minded country. And so we tend to not like to be told what to do. Our laws tend to err on the side of potential risk to ensure liberty and choices of the individual people that are making those. And other countries may make different decisions, but that's typically the way our country sees our laws. And the government's CDC recommended schedule does not have any teeth to it from its own federal mandate. There's no federal law that tells you that you have to be vaccinated for those things. However, the recommendations that come down from the CDC are enforced by law in many states for attendance to school, daycares, sometimes even food stamps and Medicaid are linked to your vaccination status. That's less common, but it does happen. And each state writes those laws differently. There was a long time ago where we had like a short list of vaccination mandates. And then as new vaccines were introduced into the medical community, many of the legislatures decided that they would just link their written law to the CDC guidance, saying that if it was on the CDC schedule, then it was required for school entry. And I don't keep track of exactly all those states, but it varies from state to state. I practice in a state with a philosophical exemption. Ohio is a state that allows you to deny vaccines just by writing a note that says, I do not like vaccines, I don't want them for my children, or even a specific one, I don't want this one, or I don't want that one. And then that can be turned into your school, effectively making the mandate not have much grit. One of the things I like about that is at least the parents have to make a conscious decision and sign a piece of paper saying what that decision is. They can't just lazily not do anything. So in that regard, they do have to make a decision not to vaccinate. But in many states, there is no exemption process besides medical or religious, and even some of the religious ones are pretty tight. And so people often say, well, you don't have to vaccinate your children in those states. I'm like, but you're being withheld things that are a part of natural society, like education or food or medical care. And our courts have been pretty clear that coercion is not consent. So it's not really consenting to that if they're withholding something that's really important to a family. And so when we decouple these recommended vaccinations at the CDC level and make more of them into what they called shared decision making, what that does is it kind of takes away so many of the required vaccinations that would be for different states. Many people, particularly in the pediatric community, feel like those recommendations and those mandates, and we know, increase vaccination rates. And because it's so important to vaccinate, they feel like that kind of infringement on human rights is worth it. And people can differ on where they feel on that. I personally don't think that infringing on human rights to accomplish a goal is the right way. I think that we should, as a public health community, be convincing in why someone would want those things and build trust and accomplish those goals through trust. So hopefully, as a practice, we are doing that for our patients. The vaccine changes are kind of significant. Many of the things that are on the vaccine schedule as listed this week by the CDC are similar to ones that were on the vaccine schedule when I was first in training in the 90s. There's a couple that stayed on that were more recent than that. And then a lot of the vaccines that have been added post 2026, 2028-ish, that were added kind of in succession, several of them in a row, have been moved over into shared decision making. So it feels a little bit like maybe they just took the new things and made them that way, which I don't think is the greatest way to make a decision. I think that we should be making decisions based on how it affects the society as a whole and the individual and whatnot. And so I have a little bit of wondering on how this list came to be. For instance, the RSV immunoglobulin is listed in a kind of odd way. It says high risk, but all babies are high risk for RSV. And so I think they were making it sound like if a mom had been vaccinated in pregnancy, that made them less high risk. But in my opinion, every baby should have an RSV prophylaxis. Of all the things that we deal with every year, I have been so thankful to have the RSV prophylaxis because it is the worst thing that affects babies in America, and we do fill up our hospital with babies that are having trouble breathing, and whether they die or not, it is really miserable. It triggers asthma. We have children that, have to be squatted to the hospital, including my own son when he was young. And so I've been thrilled that Beyfortus is here, and this year's RSV season has been great. This second year in where everybody has had it. So the change of making it sound not as important to get, I would disagree with. But at the end of the day, this really has to do with legal issues, and our country is one that tends to lean into liberty in these issues. And I support that idea. As a pediatric community, I think we need to side with parents in addressing their concerns, telling them why we want to have their children vaccinated for these things, and lean away from any type of language that makes it sound like it's a mandate or a forced thing. So our recommendations in our practice have not changed. We feel the same about all the vaccines that we felt last week. This is really more of an issue of communication and paperwork, and in our state, almost no effect on school entry because it doesn't change anything with mandates or exemptions in our state. So we feel pretty comfortable that this is more of a paperwork issue for other states and a little bit more of a bump in the road for us. So I'm going to make some more follow-up videos on individual vaccines that were changed in the schedule so that we can have some more discussion. They labeled many of the vaccines a shared decision making with your physician. And so I know parents are going to say, oh, well, then explain it to me better. And I'd like to do each of those vaccines in the shared decision making pile separately and help you better understand that. So stay tuned for more. Thanks.